Good evening. Welcome to this evening's online rally on racism and COVID-19. Thank you for joining us on Facebook, YouTube, and Twitter. My name is Khalid Mueed. I am a Labour councillor at Haringey Council, a member of the committee at my local mosque in Tottenham, and also an anti-racism campaigner with Haringey Stand Up to Racism. You can tweet about this evening's rally using the following hashtags: hashtag racism and hashtag Haringey SUTR. As you all know, that there's been a disproportionately high number of COVID-19 deaths within the BAME community. My own local mosque, which is a fairly small mosque in South Tottenham, we've had 5 members of our congregation who've recently died due to COVID-19. Overall, the figures within the BAME community is really quite staggering. 1/3 of all COVID-19 patients in intensive care are from the BAME community. 2/3 of all NHS staff who have died are all of BAME heritage. All but one of the doctors who died after contracting COVID-19 are also of BAME heritage. And in terms of the impact, the economic impact, the double the average of households who have lost jobs or income due to COVID-19 are also from the BAME community. And we've seen a rise in racism against particular communities, such as the Chinese community, who've been blamed for the spread of the virus. And locally, for example, there's been an incident in Finsbury Park where Katie Hopkins, she sent out a tweet just a couple of days ago attaching a picture of a large police presence with police vehicles, and she blamed that it was the Finsbury Park Mosque and that the members of the congregation who had apparently attacked the police officers, and she was blaming that there was a zero media coverage. Actually, it had absolutely nothing to do with the mosque. The mosque is closed, as you all know. The chief superintendent of Islington Council actually tweeted and clarified and said it's got absolutely nothing to do with the mosque or Ramadan. As we all know, there is no biological link between COVID-19 and BAME communities, but there are various factors which contribute to the disproportionately high levels of deaths, including factors such as overcrowded living conditions, insecure work, and lack of access to green spaces and so forth. So we've got an exciting lineup of speakers this evening. We've also been joined by Gary Younge, who's the keynote speaker this evening. So I'll introduce the first speaker that we've got this evening, Gary McFarlane, who is a longtime community activist, is a Haringey Stand Up to Racism activist, co-author of Say It Loud, Marxism and the Fight Against Racism, to make the introductory remarks. Over to you, Gary.
Thank you very much, Khalid. Going back 7 weeks now, I think it was, when we heard the infamous phrase from Boris Johnson that we had to prepare to lose our loved ones as they rolled out their herd immunity policy, which I prefer to call a mass death policy. And standing in those committee rooms with the other learned scientists on the SAGE group of advisory scientists was a man called Mr. Cummings, that people know as the key advisor to Boris Johnson. He's a eugenicist. That's a fancy word for saying he's a person that thinks that some people deserve to live and others deserve to die. And it would be better, in fact, if the non-productive people died. And that's really what we're seeing today, because I believe that the herd immunity policy continues. They've cloaked it somewhat, but it still goes on. Why do I say that? They claim that today 32,000 people are now dead in Britain, in the United Kingdom. The Financial Times says the figure is nearer 50,000, which you look at the ONS statistics. and compare it to the average that have died, would normally have died in past years. That's 50,000 people. Even a few weeks ago when they said 20,000 would be success, we're now well over double that if you look at the real figures. And as Carla has pointed out, the carnage is quite incredible and horrific. I know someone who's lost their mother in a care home, but a third of the deaths are in care homes. Totally unavoidable, many of those deaths. And we now have the highest, as people know, I'm sure, the highest death toll in Europe. That is an outrage. And from the beginning of this crisis, and you'll hear it from the other speakers tonight, it had become apparent to many of us the nature of the deaths. Far from us all being in it together, we noticed that there were certain people that seemed to be doing all of the dying. So very, very early on, again, as Carla has pointed out, the first 10 doctors that died were all from Black and minority ethnic backgrounds. More than that, they were all actually Muslims. And that death rate is among doctors is something like 94% are Black and minority ethnic people. And okay, there are 20% of the NHS is made up of, it's a very diverse workforce, it's made up of BAME people from BAME background, that is true, 44% of medics, but 94% are doing the dying, and that's because of institutional racism, which actually affects also the National Health Service. That's to say, those BAME doctors are in lower grades, are more likely to be on the front line. Again, Carla was mentioning the underlying health conditions that afflict many people from the Black and minority ethnic communities. Comorbidity we've heard a lot about. We've heard a lot about all the inequalities of housing and so forth. In this borough of Haringey on the east side where Tottenham is, compare it to the west side where the likes of Highgate are, and you discover that the death rate's twice as high, but the mortality and the incidence of life expectancy is you're likely to live 15 years longer if you're on the richer side, on the west side of the borough. But the key marker, the key determinant of whether you die is your occupation. That's why there's been an intersection of class and race in this pandemic. So if you're a working class person, you're much more likely to die. The Office for National Statistics did some data crunching, and they found that it's the service occupations like in health, as we've already seen, in transport. And there's a horrific case today, I don't know if people saw it, of Belly Majinga, who worked. She's now died as a ticket inspector at Victoria. Someone who I presume was a racist spat at her and said, "I have got COVID," and she's since died of COVID infection. So the transport workers, the delivery workers, the security workers, the cleaners, all of these sorts of jobs where you can't work from home, where you have to go out there onto the front line, you are an essential service, those are the people that are doing the dying. Working class people, and disproportionately, massively disproportionately, Black and minority ethnic people, to the rate of something like 4.2 times more likely to die than a white person if you're from an African Caribbean background, 3.5 times if you're from a British Pakistani background. Those are horrific figures, and far from this being an inevitability, it's actually a direct result of government policy. And that's why I think it matters what we do, and that we're meeting here today, because the backlash that greeted Johnson's attempt to drive us back to work, I say us, to drive certain people back to work, working class people, not his mates, to drive those essential workers back to work and non-essential workers back to the factories, it will lead to the deaths of tens of thousands more people unnecessarily. And why are they doing it? Because the economy comes first, to be frank. That's why they're doing it. It's got nothing to do with the science changing. In fact, much of their policy has been based on pseudoscience, to be frank. And so it's horrific, but he didn't mention anything about the care homes in his speech. He didn't mention anything about the Black minority ethnic disproportionality in the death toll. He didn't mention anything about the need for an independent inquiry into what is going on with the death of BAME, people from BAME backgrounds. None of that was mentioned by Johnson. It was all about trying to herd us back onto the tube system for us Londoners, to herd us back into dangerous situations for shop workers, for transport workers, as we've already pointed out. And it doesn't end there. There's been a spate of incidents with tasers. Now, people will probably know, but tasers, which are basically guns, but not with bullets, but with electricity, but disable people and can create massive problems for people. Some people have died after being tasered, but we've had a number of incidents of massive disproportionality in terms of the police reaction to Black and minority people. In Manchester, there's been at least 2 cases where a Black man is out shopping for his mother during lockdown and was arrested by the police. And just recently we saw a man who was taken to the ground by officers when he was with his child and tasered. And in Tottenham, it's also happened. Well, actually, it wasn't Tottenham. I think it was near Turnpike Lane about a week ago. And the Guardian reported this. A youngster was tasered up on the wall. I think he was trying to run away from the police. Was tasered by the police. So we're seeing a disproportionate level of attention and in some cases violence from the police. So again, we're not all in it together. And just to wind up there, it's not just in Britain, we're seeing it across the globe. How authoritarian governments are using this as an excuse to clamp down, but it's worse than that. It's in places like India, where the lockdown was introduced over a day and a night with no preparation, no idea of how people were going to live, how the migrant workers that are in the big cities were going to feed themselves. All of a sudden, they had to walk back hundreds of miles to their home villages because that was the only guarantee they had. They'd get some food in their mouths. In the United States of America, supposedly the richest country in the world, again, we have a situation where Trump gets the War Powers Act out, not to get masks made, not to get the ventilators made, but to force people to go back into the slaughterhouses where people are dying, getting the beef onto the table and getting the burgers into the mouth of the man that watches Fox News 24/7 and spews out racist hate, as he's done today against Chinese American journalists at their so-called press conferences, which have turned into theatres of lies, a bit like the Downing Street charade also. So it's excellent that everyone is here tonight, and let's turn our words and our meeting tonight into action. It's limited to what we could do on the street, obviously, but it can be social distancing protests. And of course, we can organize online in this day and age. And that's what people have been doing around the world, be it Amazon workers organizing to fight for safe conditions, or bus workers organizing to demand the shutting of the middle doors and to demand protection on their buses. And in distribution, in other warehouses where workers have walked out, and post offices and elsewhere where people have taken action. And we've been forced to take action, many hundreds of thousands of people, and then many more hundreds of thousands going into the next few days in order to keep ourselves alive, in order to protect our health against a government that is criminally negligent as a matter of policy, because they put profit before people.
Thank you very much. Thank you very much for setting the scene and for your introductory remarks. We will be going to the next speaker. We already touched on the impact of COVID-19 on healthcare professionals. So we've been joined by Chioma Okpara, who is a healthcare assistant working at Whittington Hospital, and she will talk about her experiences as a migrant worker on the NHS frontline. So over to you, Chioma.
Good evening, everyone. It's good having me here. I'm here to share my experience as a healthcare assistant in working with NHS. Previously, I've also worked in care home as well. And finding myself, with this pandemic, it's so scary and fearing, seeing yourself working as one of the minority in the hospital, and whenever you go in there, there is always this fear that even when I go, my family be like, oh, don't go, but I have to. Why should I go? Because if I don't go, I won't be paid and I wouldn't have any money, and I cannot claim any money because I'm not on benefits. It's quite alarming what's going on this time around, even the PPE thing. When I was watching them clapping hands on the TV for everyone. I keep wondering, I said, where are the real people working in NHS, the minorities, the cleaners, the healthcare assistants? These are the real people working there that are dying. Sometimes you might have someone to look after, and they'll tell you is queried COVID. And lo and behold, the person might have a sign of it, and you will not be properly covered to go in there. And there's a tendency, if you're not careful and if you're not strong, you might get it. And also, I keep wondering why many people in the hospital are not being tested, because they need to be tested as well. It's very important to test them so that we'll know who has it. And you keep seeing every day Black minorities dying, and it's so alarming that some of them will go to work and they come back, they're dead. And it's meaning the virus has taken over them. Even myself, I had it. A time came, I had it for a week. I was feeling funny, and I stayed home I called 111 and I stayed home for 1 week. And that 1 week I stayed home, I wasn't paid, did not receive any pay. It's quite alarming seeing us being sick and you're not paid and you have to go back to work. And it's so horrible that we are working so hard to give back to the society. Like when I renewed my visa, not quite long, I had to pay for NHS surcharge. I had to work so hard to save up to almost 2,500 pounds to see that I paid for NHS fee, the surcharge, the exam, and a lot of things that entail for me to renew my resident permit. And not only that I renewed it, there was a restriction on my visa. And that restriction debars me from having anything I want in this country. Like if I can't claim any universal credit. Because of COVID, what's going on now? If I'm not feeling too well, I even have a husband who's sick, and I had to go to work. I have a son. I had to go to work. I'm endangering myself. I had to, because if I don't go, I will pay my house rent. I will do other things. I tried to claim the universal credit, and they asked me a question: "What is the remark on your visa?" And I told them, "No recourse for public fault." The lady was like, "Okay, we'll get back to you." Up till now, nobody got back to me. And in the hospital where I'm working, there is a more shift. I have not worked for how many weeks now, but I have no pay, but I had to manage. Can you see what is going on among the Black minority, ethnic origin, even the Asians? How they are working very hard they are working very hard. They had to be there. They had to give back to the system, and all these things. We became the minority, as if we were. It's like working in slavery plantation. You work and you give back to your slave master, and we are not well looked after. It is really horrible, honestly. Many of us that are here we're not here because I know many people know what's going on back home where we came from, what's going in our country, why we all are here. And some of us are well read, but when we come here, because we are being restricted because of our papers, and we are struggling to get it before we can go back to school. We can't go back to school with my restriction. I can't go back to school, like doing maybe small courses because of restriction. I am begging and asking the government, they should do something about it. Look into this issue. Why are there so many Black minority that died in this COVID-19? It's because of this kind of situation. They are really working hard. They are working very hard to give back to the society, to take care of their family, and many of us are not well paid. We are not well paid, and we're like living from hand to mouth. We can't stay at home. You can say, I can't stay at home. I have to go to work. We can't work from home. Mostly those that did not die are those who stayed at home. But those who went out to work in that field, they will die. Definitely, they will meet their dead. And not only them meeting their dead, there are so many circumstances that surround them that lead to their death, which need to be investigated. A time came, I was so worried that I had to look into it. I said, oh my God, there is a lot. Many Black people and Asians are going through that are working in healthcare sector. So they need to look into it. It's really horrific. Thank you very much.
Thank you very much indeed, Chioma. Your experiences really bring home to us that many BAME members of staff who are on the front line, not just in the NHS, also Transport for London, many of the bus drivers who've died, and vast majority are, if not all of them, are from BAME communities. Our next speaker is Sharon Grant, who's Secretary of the Bernie Grant Trust and widow of the late Bernie Grant MP, who was MP for Tottenham. And she will touch on the disproportionate impact of the virus on BAME communities, with particular reference to Tottenham. Over to you, Sharon.
Hi, you've asked me to talk about the situation in Haringey and the disproportionate impact of the virus on the BAME community here. But what I really want to, I suppose the main point I want to make is about the real difficulty we have of getting evidence to substantiate the concerns that we have. And I think we do need to do this if we're going to form a campaign and a set of demands around this issue. The problem is that getting to the facts of the situation, either the real or true facts of the situation, either locally or nationally, to confirm what we think we are witnessing, is actually extremely difficult. The position as regards the disproportionate deaths of hospital and care staff, that's a little clearer, and we do actually have evidence on that, sadly, that has already been talked about. However, so far as the overall impact on BAME communities is concerned, the problem starts at a national level because ethnicity is not recorded on death certificates. We had some information last week from the Office for National Statistics and the NHS, which made a lot of headlines. And it does seem to confirm something in a roundabout way, using a range of statistical maneuvers, that Black as well as other minority ethnic groups have almost twice the risk of dying than have the white population. And this is seems to be particularly the case amongst males. But this is all very tentative stuff, using quite incomplete data and relying on self-reported ethnicity in the 2011 census, so over almost 10 years ago. There are also concerns about the extent to which COVID has been accurately recorded on death certificates, especially when deaths happened outside of hospitals, either in care homes or in the community. And this, no doubt, is a reflection of the testing scandal, which we have heard such a lot about. So unless people were tested, they would not have been listed as COVID deaths. We've come across this problem too when we come to focus on Haringey in particular. I've asked our Director of Public Health in Haringey, quite a good bloke, but he doesn't have any firm data either, for very much the same reason. There's some general information we have about Haringey. We've had 216 deaths with COVID recorded as the cause of death up until the 24th of April. Of those, 181 were in hospital, 19 in people's homes, 13 in care homes, and 3 recorded elsewhere. This compares with 638 deaths from all causes over the same period, so that COVID made up about a third of all deaths over that period. Haringey actually has the second lowest number of reported cases out of the 5 NCL boroughs. You know that we're part of a wider unit now in Haringey with 4 other boroughs. It does seem, from our local information, that age is a major risk factor, with the overwhelming majority of deaths being amongst the over 70s. The majority of deaths were amongst men and amongst people between 80 and 89 years of age. There seems to be some link with deprivation and risk of death, but this isn't particularly marked in the data that Director of Public Health has at the moment. Overall, the highest risk is the very elderly and those with underlying health issues. Obesity seems to be a major factor, I'm told. Contrary to what you might think, the information so far seems to indicate that deaths don't seem to be concentrated in particularly deprived wards, and they're fairly broadly spread across the borough. As far as hospitals are concerned, the vast majority of deaths in north central London occurred in the Royal Free, which more prosperous catchment area you might think, rather than the Whittington or the North Mid Hospital, which is on the Tottenham border. Another complicating factor in terms of trying to pin down the relationship between death and ethnicity here is that we have very few care homes in Haringey, and some of our residents could have passed away elsewhere than in the borough. Barnet in particular has a very high death rate, we think partly because they have such a large number of care homes in Barnet. Another little snippet of information at the North Central London level, we're told that the majority of deaths were people born in the UK or Europe, if that tells us anything. However, the main message is that we just don't know enough about ethnicity and COVID-19. And I do think it's quite a political issue that we don't know, and a political issue that goes far beyond the immediate concerns of the COVID pandemic. And I think we're quite justified in asking, why don't we know? I thought that in the 1980s in local government, as I was then with Bernie and others, we'd won the argument about keeping ethnic records on the basis that if you don't measure it, you're not going to be able to address the problem. And we did do that in local government across the board, in HR, in terms of who we employed, and in the way in which we monitored and we planned services. However, I think the NHS has never caught up with that, and local government, in fact, has pretty much gone backward on ethnic monitoring and keeping data of this kind. So I think it is time to put the black back into public health, as it were, so that we can target the inequalities that we know exist. We want to see ethnicity on death certificates, and not on death certificates, but on all data as regards health indicators, chronic health conditions and disease. It does seem to me that the only time that this happens is when health problems blamed on Black people spill over onto the wider population, for example, around issues of mental health and AIDS. And you know, I have found this in the work that I do around in health in Haringey, time and time again. I've asked for ethnic breakdown on health conditions, the reach of both health and social care services, but to no avail. And I hope that this is something we can start to change arising out of this crisis. I was cheered to an extent by reading Professor Kindy's Andrews article this week on Black deaths during COVID-19. As he said, these are his words really. It really shouldn't come to any surprise to us. And we can take it as read virtually. There are disproportionate death rates for ethnic minorities. It's what anyone would have predicted and reflects the iron law of health inequalities that ethnic minorities suffer the worst outcomes across most illnesses and conditions. As he says, it's our position in the pecking order in terms of jobs we do, which expose us to the virus, where we live, what health conditions we already have, and these predispose us to the worst outcomes, he says. And he also points out, and I think these are important points, that this isn't due to individual acts of racism, but due to structural inequality that this situation prevails, which has its deep roots in centuries of history and oppression. COVID, as he reminds us, is a symptom, and it's not the disease. Having said that, I do think that demanding that data be kept is the best hope we have of addressing both this and future health challenges for minorities. Research is also key in this. It's a particular interest of mine, and it's simply astonishing how little research and how little money is spent on research around the main health challenges facing BAME communities in this country, whether it be physical or mental health. Once you have the data, you can expose the deficits in healthcare, construct appropriate demands, especially on targeting preventive messages, so that we can put Black back into public health and start to address the needs of Haringey's Black community. There are a couple of other points that I'd want to make before I finish. The first of which is the pretty serious predicament that's facing the Black voluntary and community sector. Many of them are being absolutely decimated as a result of this crisis. Their income is dried up, the rents that they might get from renting their premises, they're just not coming in. And yet, on the other hand, they're often being relied on by the statutory sector to reach certain sectors of the community. Part of any campaign that we have, I think, has to be about the borough, our borough and other boroughs, continuing to support the community and voluntary sector going forward. And I hope we can talk about that later. And finally, in the short term, we have to be raising issues about the backlog of general health concerns that there will be as a result of this crisis, particularly amongst the Black elderly. Certainly many of them that I've talked to, they have been absolutely terrified. They're seeing these stories every day about disproportionate deaths of Black people. They are very, very frightened in their own homes. And but at the same time, they will have, over this period, many of them would have wanted and needed to consult their GP or gone to hospital or whatever, but we know that they are not going. Attendance at A&E, for example, has just shriveled over this period. And I don't think that's because people don't have any problems, it's because they're terrified about going anywhere near a hospital. So we need to look at ways in which we might want to set up some particularly targeted work towards Black elderly in particular, to see if there are any health issues that we ought to be addressing over the coming period. This is going to go on for a while, and for the longer it goes on, the more we will need to be targeting our elderly to ensure that they are not sitting at home getting more and more sick. Okay, I think that's all for me for now.
Thank you very much, Sharon. Let me introduce our next speaker. We have Hesketh Benoit. Hesketh is ex-England basketball player, long-time head basketball coach for Haringey, youth worker, lecturer, and a community activist in Tottenham. He will give a personal testimony of the impact of COVID deaths and racism on his friends and the community in Tottenham, including the racist response of the police to the Black community. So over to Hesketh.
Welcome everybody. Thank you very much for the intro. It's just crazy. Hello to everybody on the panel and people that are listening in. But for me, the statistics, they all gear up. It all bites for me in a big, big way, because my personal sort of rendition on COVID-19 basically started 6 weeks ago, and very famous record producer from UK Reggae phoned me up, and he was in the hospital in Paddington, and basically phoned me up in the morning. By 3 o'clock he passed away, and that was the first one for me in regards to a very personal friend. Then it moved on with the numbers accelerating from that first week. Week 6 roughly was the first one, and then it accelerated within that week. So, you know, the statistics and the curves, these, you know, advisors, it's really true. It's really happened. I actually now the figure of 26 people, 25 male, which have passed away local, and some a little bit outside Haringey, but Enfield, Barnet, and Brent. Obviously, I've got some friends in, but they actually did their work in Haringey. That's why I became friends with them. But for me, it's a reality that you know, the numbers for me when I heard it, this was before hearing any disproportion. I just thought this is crazy. I just thought that, hold on, I heard Delroy Washington die. Then within the space of a week, 5 people died. I must say that obviously with that number, there is about 6 or 7 which were over 80. So in our community, we say, all right, the brother has had a decent life. He's got to 80 and done his community work, but now he's passed. And then thinking, then the numbers kept coming in, and then we hit a couple of 60-year-olds, 50-year-olds, and even 40-year-olds. Those of you who know in Haringey, a very good friend of mine, brother Dougie, he had some underlining, but all these ones have bounced down to see COVID-19. So these people, whether they were had something else, but they were the report that I got back is I started asking what they die of from the first one, and it's the COVID. And as the sister just said regarding on the nursing side, it hit me kind of really hard, especially then hearing about the BAME community, the numbers so disproportional. So we hear the figures and we get to know the figures, but we then know, it's just totally, this is a real life business where it is totally disproportionate. Someone like me, I do know a lot of people in the borough, but all of them, I haven't actually got figures. And with what you just said about what I do in the borough, I know black and white people. I haven't heard any white person died. One of the doctors that put up on the telly, he was a very close friend of mine. And when I started seeing that, the numbers coming in, I just thought, there's no knee-jerk reaction. This is shown that as black people, black and BAME people, Asian people included, that we are there. My son, he works on the buses. When I started hearing that, I started saying, what about your PPE? He said, there's nothing there for us, Dad. I said to him, well, Mum started pulling out the stuff, saying, make sure you cover yourself in your cabin. He's got a nephew, one of my nephews, which got him into the sort of bus business. Same thing. So, and they're saying that, they're just not looking after us. We're there on the front line with the public, and we have got no equipment to deal with, on a daily basis. And I hear it, all the different, key workers that are hitting the same way. Where it cries out to me as someone that, in the borough, asking questions and what have you, the likes of why I believe, and I'll say openly, is that, they say underlining, and we know the high blood pressure, the overweight, the diabetes, but, it's been around, black people have been around in the country for a long while. NHS, in terms of if they felt a certain way and they know these things are going on, these underlying wouldn't be just there for black people. And it seems that that's what they're saying now. But this other thing about the likes of the stresses and strains in different position of the jobs that, BAME people get, and believe me, even if you're a doctor and you're pressurized at work, that brings down your immune system. Having to handle, lots of work and your counterparts are not handling as much work of you and you're saying yes, 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 obviously that's going to have you under stress. And stress is the kind of thing that you don't see it happening, but it brings down your immune system. So therefore, when something like this COVID came around, obviously now they're talking about the likes of, the numbers, the figures. But that's there, but it's been there for, many, many years. As the sister talked about, going to the plantation. The men, as I figured out on my figures, I don't have to work out any statistics. It was only the other day, one of my students rang me and said his mum's passed away with COVID, and that became the first woman that passed. So the black BAME men have been hit quite hardly with COVID, and I start to sort of think, it is them figures that are real. But what we're going to do about it, because it's not no knee-jerk reaction now, we have to have some real action. I do want to talk a little bit about, because for me, I'm dear to heart the youth. And as Gary, I think, mentioned, I was on a fairly big Zoom meeting last week regarding a young man that was shot off a wall. And again, people are on that committee, Community Against Violence, and the likes of other committees, Stop and Search, which, I represent on there. And you hear these things. I don't hear of, the likes of this taser gun being used readily. The man that got tasered with his son right beside him, he weren't going to run away and leave his son, but yet they decide to tase him. The guy that's running away from the police, he weren't running to the police with a gun or a knife, he was running away, gets on a wall, which is roughly 10 foot high, and then tasered on the wall. And the drop from that wall was more than 15 foot. Now he's left with paralyzing situation where a young man at 23 won't be able to walk, might be in a wheelchair for all his life. That's a serious situation for the police. And we sat there as people in the committee, white and black this was, saying, you know, where is the, you know, the health and safety with the police sort of deciding whether he should shoot his taser at a young man on top of a wall? He had to, you know, he climbed up the wall 10 foot high. So even if he dropped on a 10 foot high wall to break his fall, if he was all right, much less, you know, to be totally paralyzed, you're going to get a broken neck or back. And, you know, the chief of police or the superintendent, you know, talked about it, started talking about various things, not sort of looking at, you know, this young man and the police that actually decide to shoot the taser, which, you know, I listen out to the news. I don't hear these reports with other, you know, the white community getting tasered. It seems to be, I call it, you know, in America, they've got the guns and they're trigger happy with the real guns. In this country, they're becoming very taser happy and shooting a lot of black youngsters with a taser gun.
Thank you, Hesketh, for sharing your personal experience. I could definitely relate to the point you made about your son and the lack of PPE on the bus. The British Medical Association, they've done a survey and they've found that 64% of BAME doctors have expressed a lack of, inadequate PPE or lack of provision of PPE. And this compares to only 33% of white doctors. Now, I've got a close family friend, a doctor, Dr. Abdul Mabood Chowdhury, who passed away due to COVID-19. And 2 weeks before his death, he'd actually written a Facebook status where he was addressing the Prime Minister directly and expressing a concern about the inadequate PPE for the NHS professionals. So the next thing that we've got lined up for you is a short video on COVID and racism. This video is by our local MP in Tottenham, David Lammy. David Lammy, who is also the Shadow Justice Secretary from the Labour Party. So we've got the short video from David Lammy.
Friends, we have a crisis, a tsunami that is shaking every black and ethnic minority family across this country. And that is that if you're black, 4 times more likely to die from the coronavirus than your white counterparts. It is hugely important that this government get on top quickly of the reasons underlying that. We know that before coronavirus, black and ethnic minorities in this country were deeply disadvantaged, were discriminated against, experienced racism and huge structural inequalities in our country. And no doubt that will be a big factor now in who dies and who lives. But we also know that there may well be epidemiological and pathological reasons why this virus affects different communities in different ways. And so what we need is to know why and how, and more importantly, what can black and ethnic minorities do in the United Kingdom to protect their loved ones and to protect themselves. We need a quick and urgent review that has the confidence of the communities that are dying in these huge numbers. It's now got to the situation where it's very hard not to know someone or some family that has lost a loved one. And so I will continue to ask the questions from the Labour front bench in my justice brief, but I urge you to keep up the pressure and the fight to demand answers to these issues that are discriminating so widely. Yet again, we see black and brown people at the front of the queue. And just finally, it is deeply concerning that as Boris Johnson announces relaxing the lockdown, it is still the case that black and ethnic minority people in this country are not protected and do not have that understanding. How can you relax the rules when people are dying disproportionately at this time? So it's really important to stand together, to keep up the pressure, to challenge for the questions, and to protect our community.
Okay, I think we're having a slight difficulty with the technology. We couldn't actually hear the video, but hopefully people watching from home could hear the video. The next speaker that we have is Roger Mackenzie, who is chair of Bernie Grant Trust and Assistant General Secretary of Unison. And he will talk about the overall context of COVID-19 and racism and the union perspective. So over to you, Roger.
Right, many thanks. I have to say, I'm not too fussed about hearing quite a lot of MPs, but that would have been quite nice to hear what David Lammy had to say. So anyway, hopefully that can be sorted out. Can I thank you very much for the opportunity to join you and say a few words this evening. I think people have to get really vexed about what's going on at the moment, frankly. They being the government, have deliberately put Black people, they have deliberately put a whole load of care workers in harm's way. It's not an accident. It's not something that just happens because things have been organized badly or something. They've deliberately done it. And if we don't get vexed about this and understand what's going on about the rise of racism in this country during this lockdown, it's easy to think that during a lockdown, well, we're not walking down the street as much, so we're not going to get spat at or have things thrown at us in the same way that many of us do experience, or that, you know, everyone's jolly and happy in delivering healthcare and social care at the minute, because after all, we stand outside on a Thursday at 8 o'clock and applaud everybody. Things don't work that way in life. What is happening is that the racists are also using this opportunity to organize as well, absolutely using this opportunity. But also what happens is that, as we have heard already, is that Black people are being disproportionately affected by this virus. Now, some people will say, yeah, but you know, there's all sorts of biological reasons why apparently Black people are more susceptible to this virus. It's absolute nonsense. The reason why we're experiencing higher numbers of exposure to this virus is, one, because of poverty, and the way that we are in the worst jobs, in the worst conditions, and therefore also have the worst diets of everybody else. All of those things have an impact. But also what is happening is that we are deliberately being put into situations where we don't have personal protective equipment, deliberately being put in the way. Now, that's a harsh thing to say, but I do think that it's true. It wasn't so many weeks ago, you know, where we were being told by this very government that actually care workers, they're not very skilled, they're not very important. And by the way, loads of them are Black workers, as we know, migrant workers as well, in that aren't Black, but loads of Black workers delivering social care, but they're unimportant. Now we stand outside on a Thursday at 8 o'clock and we applaud people. Now, I have to tell you, I have no problem whatsoever in standing up and applauding care workers because they deserve applause for what they are doing. But I'll tell you what applause doesn't do. It doesn't pay the bills. It doesn't put bread on the table. It doesn't keep a roof over your heads. So what I'm really concerned about right now is the fact that a few weeks ago, then they were unimportant people. At the moment, they're the most important people on the planet, and we'll all applaud them. But in a few weeks' time, when we're out of lockdown, will people forget about the contribution that these workers have made? And again, I'll emphasize, many of them Black workers. Our National Health Service, remember, as we all know, would not be in existence, would not survive without the contribution that Black workers and the contribution that migrant workers more generally make to the National Health Service. But it's wider than the National Health Service, of course. It's also about the care sector more generally. And part of what I think we have to not forget to argue for is the fact that we've got loads of private providers of care within this country who treat the workers who work for to deliver their care like there's something that they're scraped off the bottom of their shoe. And it's no accident they think they can get away with it in those areas because we're poorly organized as a trade union movement in those areas, and we have to do something about that, and we are trying to do something to build some power for working people within those private sector care providers. But in the end, the answer to the private sector care providers is that there shouldn't be private sector care providers. There should be, all of that work should be provided by the public sector. It should be renationalized, if you like. And I think that's an argument that we will have plenty of evidence from this current crisis to support. That some of the ways that these employers have behaved has been appalling. You know, the way that they've insisted on people sleeping in some of these care homes, some of the residential care homes, not given much choice, because as the sister said before, if you don't work, you don't eat, basically. So some people are being basically told with hardly any notice at all, they have to go into work and they have to sleep over in these in these care homes, away from their families with no notice, putting themselves at in harm's way. And I think that's something that we have to be able to expose. But it's wrong as well just to think of this as being something that is just about the UK, of course, and I think Gary touched on this earlier on. But there's an international dimension to what we're experiencing at the minute. So you look at the United States, and Gary, I think, did mention about the way that African Americans are disproportionately affected by the virus in the US as well. But what we also see is lynching again. So Ahmaud Arbery lynched for just going outside his house for a jog, a route that he often takes, and is shot dead. And the only reason something's done about it is because a video emerged, because this thing happened back in February. We see similar situations of the disproportionate impact of the Black community in Canada. We see that fascist who purports to be the head of state in Brazil treating Black people, the place where more Black people were enslaved than anywhere else, where they treat them like rubbish, and people are just being exposed to the virus at will. And then we see somebody in France, and I can't remember whether it was a government person or it was a so-called scientist, basically saying that that we should test any virus medicine. We should test them on people in Africa first. You know, this is the sort of thing that we're seeing. And then you come back to the UK, and we see a man with his daughter tasered in Manchester earlier on, just a few days ago, in front of his daughter. They didn't just taser him once, they tasered him twice in front of his daughter. And that's what we're experiencing right now. And we see two footballers who today have reported that they've faced major discrimination on social media. So Ian Wright and Gabby Agbonlahor. And they won't be the only ones. Loads of people are experiencing this at the minute. Fact is, we're meeting like this, but the right wing are also meeting in their Zoom groups as well, and planning on what they're going to do and how they're going to take advantage of this whole situation. Because I tell you what, we're going to be faced with austerity at the end of this lockdown. Massive austerity, because they have to pay for the money that they've dished out, money that they always said didn't exist, by the way, but somehow does exist. They're going to want to pay that money back. And the only place that they can take it from is going to be particularly local government. And that move's already started. We've started to see the settlement with local government, which is a massive shift, again, of resources to the Tory shires and away from the inner cities. We've already started to see that. They won't be able to do the things that they originally wanted to do, was just to cut. I think what they want to do is to have massive cuts across the National Health Service. That's too sensitive. They won't be able to do that immediately, but they will eventually. They will do that, and they will still look to do their Windrush policy of removing people who have delivered the sort of healthcare that everyone lauds on a Thursday evening. So I think people have a right to be upset. I think people have a right to be really vexed about what is taking place. The only question that matters now is, what are we prepared to do about it? It's the only question. What are we going to do about it? And I say what I always say at every meeting, what I've said for years, is that we have to organise. We can have as many inquiries as we like, whether they're government inquiries, Labour Party inquiries, whoever's inquiry. One of the things that we know about inquiries is that they don't work for our benefit unless we're organised, unless our voice is heard, so that they know that they can't get away with just any old inquiry that whitewashes the whole thing. We have to get up, make sure our voices are heard, and we have to organise, not just during the lockdown, but for the challenges that are to come in the next few months and years, because it's gonna be tough, and the racists are gonna be, you know, they would have used the opportunity to organise, and we have to use the opportunity to organise ourselves for the fight that needs to come. I'll finish with this. You know, no one's ever given us anything as Black people, never, right? Never given us a thing. What we know is that we are being, you know, we are being killed in greater numbers than anybody else because of this virus. What we also know is there's probably going to be a second wave of this virus later on this year or early on next year. Now, I don't want to be in the same situation again, where I'm saying that this is all disproportionately affecting Black people and still nothing has been done about it. Most of all, that people are still being put in harm's way with no personal protective equipment in sight, or if they do get it, they're told to use it again and reuse it again after that. This is unacceptable. This is not why people got into the healthcare. They want to look after their families, and they want to put bread on the table. They want to live, because that is the fear that many people are experiencing at the moment. They are going to work. The basic thing, you go to work, you should be able to expect to come home safely in the evening. And many of our members, many public service workers, many social care workers do not have that luxury of thinking that they're going to be able to come home safe that evening. That is unacceptable in the 5th richest country in the history of the world. Something like that should never be allowed to happen. So let's get up and organise and make our voices heard. Thanks very much for listening.
Thank you very much, Roger. And I've also just learned that it wasn't just the panel members. People watching it at home also couldn't hear the David Lammy video. So we're going to try and play it again so that everybody gets to hear it. But before I do that, I know that many people who've joined online, they've made comments on the Facebook. So I'll just read out a couple of comments. So here is a comment from Anna, who's saying, who are the majority of people who are going to have to use public transport, as Boris Johnson actively encourages people to go to work? It will be poorer, and because of racism, more BAME workers. No return until it's safe. Here is another message from Michelle. She says, 4 members of staff at Barnet, Enfield and Haringey NHS have died from COVID-19. All 4 are Black men. Poorer life experiences, housing, systematically racially motivated policies which remove opportunities for BAME communities to improve social outcomes. Thank you for your messages. I'm sorry I can't get to all of them, but please, put your comments on Facebook. You can also tweet using the hashtag racism and hashtag Haringey SUTR. We've also had apology from Catherine West MP, who's the MP for Hornsey and Wood Green, which is the other constituency in Haringey. She couldn't join us this evening. Now we have our keynote speaker, Gary Younge, who is a journalist, author, broadcaster, and professor of sociology at Manchester University. Please welcome Gary to give the keynote speech this evening.
Hi there, and I know time's running on, so I'm going to be a little bit briefer, but I want to start with the reflection, which is that I covered Hurricane Katrina, and it it was striking the way that for a moment, the American polity and the media and the rest kind of discovered racial inequality, and they only discovered it because they couldn't deny it. All of these things, all of these inequalities that had been embedded in this southern state for years were washed up, literally washed up, bodies floating in the street, people stranded on rooftops, a massively disproportionate number of people, of Black people who died, and many of whom never returned to the city. And I remember, because I was reporting on it for The Guardian and driving around a year later in the 9th Ward with a woman called Antoinette K. Doe. And it was still, a year later, it was like some awful hellscape. There were cars in trees and trees coming out of houses, and still the kind of the inscriptions they would put that would say, you know, the date that they came, the number of dead people who were there. And she said to me, "We're the richest country in the world. I don't understand." And she was genuinely perplexed. "I don't understand why we can't fix this." And when I look at who is suffering from COVID, and Sharon's right, we don't have all of the figures, but we have enough of the figures from the government's own sources, the ONS, saying that for Black men 4.2, Black women 4.3, Guardian survey showing the more likely you are to live in a place where Black people exist, the more likely those places are to have instances of COVID. We know, and then we know anecdotally from the things that have been said, who is suffering, and we know why too. It's no mystery to us that, and there is a sort of peculiar game going on here, because on the one hand, we have, well, Boris Johnson's described our children as smiling pickaninnies with watermelon smiles. He has belittled us in a range of ways, this Prime Minister ostensibly of ours, and yet in this moment where the country is flat on its back and the government is on its knees, we are the key workers. We're the people that keep this bloody country going. Not just Black people, but also immigrants. The very people, once again, the very people that this country depends on are the people who are also most reviled. This is not the first time, and I'm sure it won't be the last. But they're not saying, all of you bomb traders, you have to be at work. It's very important that you are allowed to carry on. All of you asset strippers, it's not that, it's bus drivers and nurses and the people who keep this country going, that the country could not survive without us. And there are a number of things that I think are in play right now, and this is one of them, that we have to be sure, make every effort that is never forgotten. That whenever anybody starts talking about immigrants and Black people and Muslims and so on, these are the people who wiped your behind. These are the people who got you from A to B. These are the people, your life depends on us, not the other way around. And so what this virus has shown us is that we don't just fall foul, we're not just more likely to fall foul of the law of the land in the way that Roger has described and others have described, but actually the law of probabilities, that we are more likely to be poor, more likely to be in the kind of housing that makes it much more difficult to social distance, more likely to be in low paid work, more likely to have to work, more likely to be working in the health service, more likely to be working in on the buses, and therefore more likely to die. And this is not, as Roger pointed out, a local problem. In America, in Michigan, Black people make up 14% of the state, 14% of the state, 40% of the deaths. In Louisiana, where Katrina happened, 33% of the state, 70% of the deaths. Being black is a pre-existing condition. It is an underlying condition. And that kind of, in America, in a country where a black man in DC, where they make the rules and break the rules, a black man in DC has a lower life expectancy than a man on the Gaza Strip. That's according to the CIA and American government's own figures. So, of course, when something like this hits, it hits the poorest hardest. Look at any country before anybody starts bamboozling you with vitamin D and kind of a range of ways in which our kind of bodies just are kind of more receptive to death. Look at the fact that in every single country, it will be the poorest who will be most likely to die. Well, they're not all of the same ethnicity, are they? And so how can it be that kind of that us and African Americans and the Amazonian Indians and the kind of the Boer in France and the Turks, if you just go around the world and look at who's dying, it will be the poorest. And we are overrepresented. If you're brown, you're overrepresented amongst the brown or black, then you're overrepresented amongst the poor. This brings us to what I think is a very important place in terms of finding a way to talk about racism in a way that makes sense. And that ultimately, we have awful people in government, of course we do, and they're doing awful things. But ultimately, it's a system and a structure. It's not about good people and bad people. That good people in a terrible structure. Nobody is physically saying or personally saying to that nurse or that person, you go there and you die. It's the kind of, the rotas are made up and the people with the confidence get the best times and the people who are the more, who live in the best areas and go to the best schools, get the best education and so on and so forth. And this is how racism works. It's a cradle to grave thing and it's systemic. Nobody's going out and injecting us with COVID. It's not that the virus discriminates, it's society that discriminates constantly. And we are the most likely to be the victims of that discrimination, the most likely, but not the only. And this is important in terms of building coalitions, to understand that we're dying because we're poor, not because we're black. And therefore, we have to stop. People have to stop trying to dislocate conversations of race and conversations of class as though they are taking place in two separate universes, as though you can understand class in Britain without understanding race, as though you can understand race in Britain without understanding class. Just look at who is fronting the government's message and you'll see plenty of BAME people up there, because if the hands on the machine, it's the machine that is racist, the hands on the machine doesn't care if it's a brown hand or a black hand that's on the machine that's killing us. So we have to kind of integrate our understanding of race and class. And that means not only that we understand what's happened to us now, but we are better equipped to fight it. Because as has been mentioned, we're not the only people having these meetings. We are about to approach a recession and probably a depression. That's when racism goes up. There are scavengers and vultures at the gate ready to eat on the carnage of this situation and exploit it to make us even less safe than we are now. And so we, as Roger said, have to organize, have to make noise, which at the moment is pretty much all we can do, have to kind of lobby and agitate and be sure that there is a price to pay. There's no way this government gives people 80% of their furloughed pay because they're nice people. They do it because, first of all, they need to keep the economy going. And secondly, they're scared of what will happen if they don't. And we have to make sure that the price of ignoring us is much higher for them than the price of engaging us. That we will make it impossible for them to ignore us. There's a quote from Lenin, always found it useful in the last 10 years, that capitalists will buy themselves out of any crisis so long as they make the workers pay. That's what they did. That's what they did with the economic crisis. It wasn't Roma and gypsies who did the debt credit default swaps, and it wasn't immigrants or public sector workers who ran down the economy. It was bankers, and the bankers kept the bonuses, and they managed to blame it all on the poor and the brown and the migrant. That's what they did. We cannot let them do that again. We cannot, the very people that they call, if you want to see the flexibility of their thinking, the way that we can lose this, that the very people who they called scroungers before, they're calling heroes now. The people who they said were bankrupting the economy, the people who were kind of overpaid and underworked and lazy, they're the people that they're calling heroes now. Don't think that they can't call us scroungers again, because they can. And so I end with a quote from an American, Frederick Douglass, who said, "Power concedes nothing without a demand. It never has, and it never will." That we have to start making demands, and we have to apply pressure in the most rigorous and relentless fashion, because our lives, and even though they don't know it, their lives depend on it. Thank you.
Thank you, Gary, for those powerful words and for putting all of this into perspective. And something that you said earlier on, which really resonates: being Black is an underlying condition. Thank you very much indeed. We're now going to go to the final speaker of tonight's rally, Gary McFarlane, who will make the closing remarks and the demands arising from tonight's rally. Gary McFarlane.
Yes, I'll take that from the top. No return to unsafe workplaces has to be our first action point. That means encouraging everyone we know to make sure that they stay safe and keep safe. So no going back to unsafe workplaces, and demanding the protection if we are in workplaces. We need to sign a statement for a public inquiry. We need to sign a statement for a public inquiry which Stand Up to Racism is circulating. It's already been signed by Diane Abbott and I believe John McDonnell and many others. So get across to the website and get that signed. Join the protest on Thursday, because clapping is not enough, has already been said tonight. We need protest. We need to actually turn anger into action. And we've been doing that over the past couple of weeks with cavalcades going around Tottenham and Haringey, putting out the message for PPE now and no return to unsafe workplaces. And lastly, here in Haringey, we need to be ready to protest to support the family of the youngster that was tasered, whenever that protest might happen, or whatever it is that the family would like us to do to show solidarity with them. So I'll leave it at that. And together we go forward as one united working class, not black and white separated. On the contrary, we as ordinary working people are in it together in the fight of our lives to stop these Tories killing us.
Yes, definitely.
Thank you, Gary McFarlane, and thank you to all our speakers for giving your valuable time this evening. Thank you to everybody who's joined from home, online, on Facebook, on Twitter, on YouTube. Until next time, thank you very much and take care.
Thank you.